Hello, everyone. I want to welcome you tonight to our webinar, Confusion versus Common Sense, Cleaning, Disinfecting, and Sanitizing. Do you know the difference? What are we going to talk about during this time together tonight is really just giving you some ideas and really thinking of some of the things that we can accomplish and make it, again, common sense for our practice and for all the young team members that we have, especially over the last couple of months. It's one of the things that I will tell you is I know so many practices are calling and saying, hey, Shannon, do you have an assistant or do you know of a good hygienist? We are looking for team members. And right now, it's a critical time for us, and so many practices in my area right now, there's about 32 offices looking for dental assistants. And that's not including the hygienists. And so one of the things that we know is we are only as good as the person that trained us when we think about this area of dentistry and really all the areas of dentistry. But the most important component of that is really understanding how do we set up a room and break it down, and how do we make sure that we are taking care of ourselves, taking care of our team, and taking care of our patients. And we think about most of the team members that are coming in, especially if there's someone that doesn't have a dental background or dental experience, we're training them. And I think sometimes because we are in dentistry, we make it really hard for them to understand. And when I say thinking about common sense, I always refer to, new team members, but I got to tell you, there's a lot of team members that are in practices that will ask me questions and they'll say, Shane, I don't want to sound dumb, but I don't want to ask this question. So can you answer it for me? And I can tell you that I'm not Einstein, but I know that, things have to make sense to me in order for me to get it. And most importantly, in order for me to implement it. And so what I want to do tonight is really just give you some ideas of how you can understand things yourself. And most importantly, be able to pass that on to your team members and not making them feel, inadequate, or most importantly, not know what they're talking about, because these are areas right now where there's so much change. And even today, we just got an alert where I live in Virginia, and I am from Virginia Beach, where they're changing, requirements for school, and the kids, have an option of wearing a mask or not. And we're just hearing these things on a daily basis. And how do we keep up? And so I'm so grateful tonight to be able to share with you really, I think, 3 of the most important common sense areas for me, and give, any team member that is really new to dentistry, give them something to think about. And hopefully, if they're not listening and you are, and you're the infection control coordinator or the person that really is doing some training, maybe you'll get some tips in the meantime. So within this course, we want to talk about, again, several areas that really utilize common sense and, most importantly, help us to make good decisions for ourselves. And most importantly, I want to just mention before we start that I always give a disclaimer that I'm not a dentist, I'm a dental assistant, and I have been for almost 32 years now. I'm so grateful for Viva for just allowing me to talk about dentistry, because that's really my love, my passion, and you'll see that tonight. But most importantly, being able to be very candid with you, and I love that. This is probably the only platform that I do courses for other than my own, where I can do just that. And so I appreciate that. And when I say that, I always want to have a disclaimer about the things that I'm talking about. And most importantly, making sure that you understand that, there are protocols, and there are many people that, play a factor in us putting these programs together. And I will say that, for me, it is really based a lot of it on my own opinion and some of the things that I know. But I also want to give credit where credit is due, and that it's not just me. I have a team of trainers, and I have a lot of people in my life that have helped me along the way. And so I just want to say that I really appreciate that. And thank you for letting me share that with you. So why is this important to me? Well, the first thing that I will say is that we have to protect ourselves. And tonight, that's what we're going to be talking about, is how do we protect ourselves and protect, even our families. Some of the things that I'm going to talk about are not just me. It's not going to be just something that I'm doing. There's some things that I've learned, and I'm going to share that with you, because again, I told you, I don't know everything. I'm learning things on a daily basis, but if I can pass it on to you, I feel like it was worth your time. So we want to protect ourselves. We also want to protect our team. And that to me is very important. And I see this a lot, where we have to think about, as team members, we have to, if we see somebody that's not doing something correctly, we have to say something. And if someone is correcting me and what I'm doing throughout any procedure, it doesn't have to be infection control. I have to really appreciate that and to take what they're saying to me, and not take it offensive, but that they're trying to help me do better. And so that's one of the things I think sometimes in dentistry is we always just assume that somebody's coming after us or somebody's coming at us, and no, I think sometimes we take things the wrong way. And so sometimes what we say and the way that we accept, information, it is something that you kind of have to take a step back and say, you know what, are they right? Are they really telling me these things to make me a better clinician and better, just being careful? So that's what I want you to really think about, and vice versa. And so I'm not only going to protect myself, I want to protect my team. I want to think about my patients that are coming in and protecting the patients. But when we think about infection control, a lot of people just assume that that is for the patient. But the most important person that it protects is you. You're first, then the practice and the team, and then the patient. And that's what I want to go through tonight. I want to also just kind of take a step back and make sure that some of the things that for some of you that are going to be listening tonight will be elementary. But there's some of you that maybe need this. And I am not here to PowerPoint you by death tonight. I want to really just give you just a few areas, because I'm sure that you have been infection controlled to death, and we all have. But there's still things that people have not talked about. And just making it very simple to where, you do have some understanding of some of the things that you can do. And most importantly, sharing with you some of the products that have been released to where you can just make your lives so much easier. But we have to understand first that how does that transmission of disease happen? It happens directly. It can also be indirectly. And when we think about splash, splatter, blood, saliva, secretion, there's a lot of things that we really want to think about. But what I also want you to understand is that what we really, we used to be, and this has happened, when I was a really young assistant, we were so focused on hepatitis and herpes and the herpes virus 1 and 2. We were, so worried about tuberculosis, which we should be. And then now having COVID on top of that, there's just so many areas that we have to be careful. And I think that it has really raised an awareness for us to really make sure that we're doing the best we possibly can. So when we think about, all the things that we're utilizing in the practice, I want you to really think in your mind tonight as we go through this, what is the most important thing right now that we have to understand? And that is disease transmission through aerosols. And this is something that we all have heard over and over and over, the aerosol mist, the aerosol splatter. We also want to make sure that we are understanding that, when we think about things that are sitting on a counter or something that's touched the chair, or maybe something that's on, on an instrument or whatever, those things we can take care of. It's the things that are in the air that we have to be aware of the most. And so now I feel like, it's all coming full circle. We have to really think about, again, not just the aerosols, we have to think about protecting ourselves and our skin. The barriers that we're utilizing. And again, thinking about, going back to the tuberculosis, the hepatitis, hepatitis C, and hepatitis B. I have a young assistant that just called me on Monday that accidentally got stuck from a needle, and the patient has hepatitis C, and she's very scared, and so these are the things that we really and truly have to think about, on top of all of that. And when we go to and we talk about one of the first areas, though, of I feel like, where we don't know enough about, and I will be firsthand to tell you that the things that I've done wrong. And that was one of the things that I thought was so great about having the podcast and just being transparent is, being a mom and having 6 kids. Yes, I do have 6 kids. One of the things that to me was very important was thinking about my kids' health and their hand hygiene, because I have a daughter that puts everything in her mouth. And when I say that, she puts everything in her mouth. I mean, it is, I'm like, oh my gosh, from day one, and especially if we're dealing with our kids and family who have anxiety, these are the things that we really need to look at. But, when we know about, thinking about our protective clothing and, what are we wearing? Our face mask now, that's becoming now a serious issue again with the face masks that we're wearing in our offices. And is it the right level of mask that we're really utilizing? And are we using face shields and eyewear? I have a dentist just 2 weeks ago that told me that he was not giving his patients eyewear, that he wears his loupes, and he's got an assistant that wears loupes, his hygienist wears loupes, but they didn't really focus on the patient, and the patient had some of the crown that he was cutting off get into the eye, and now the patient's very upset. And so these are the things, again, that we got to think about, protecting ourselves, protecting those patients, and then the gloves. And the first place that I want to start is with hand hygiene. Why do I want to talk about hand hygiene? Because I will tell you that this was probably the number one area where I was wrong. And when I say that, I was wrong. When I think about hand hygiene, one of the things that I always would ride my kids and my husband about is washing your hands, washing your hands, washing your hands. And I can tell you that I know that the skin is very important. And what I want you to understand is that we do have cells and what we call lipids that are packed really tight in the skin, and we can see that. And of course, as we get older, it starts to loosen a little bit, right? But really, skin is basically, I would say, comparing it to a brick, right? A brick. And when we think about the mortar, which was basically the cement that's in between it, we have to keep our hands, in the skin really tight. And by doing that, we have to keep that moisture in. And I will say that, when we talk about irritants, when we think about allergens and pathogens, this is what's going to break down the skin. And I will say that I always, again, going back to riding my husband, riding my kids, wash your hands, wash your hands, wash your hands with warm water, wash your hands with soap and water. And not really knowing enough about the skin and how damaging soap can be. And I will say that, just working with amazing companies like Purell, and just really having the videos that really help us, because, in dentistry, we don't read a lot as we should, but having videos and having a better understanding, but most importantly, reading more on skin irritation, because I have a lot of allergies. This really enlightened me, as to, because I would always say, well, you know what, having hand sanitizers are great, but there's nothing really better than, warm soap and water, and we're scrubbing our hands. But little did I really have a better understanding about the skin and what we're doing to the skin by using a lot of the soap and water, where it really just, seeing that and just reading more and having a better understanding changed my mind 100%. And so I had to kind of go back to my husband and say, okay, I'm sorry, I was wrong. Because he always said, no, I've done the hand sanitizer, I'm like, yeah, but you got to wash your hands, and make sure you're washing your hands and with soap. And I will tell you that, I have to kind of eat my words a little bit, and he loves that. So we want to make sure that, again, we understand that and then when are we really looking to utilize, because that's something that, again, a lot of team members don't know, is when do we use soap and water, and when do we use hand sanitizer? Because, again, I feel like in dentistry, if we, we're always looking at, taking the gloves off and washing our hands with soap and water, and doing that so many times, depending on how many patients you see a day, you can imagine what we're going to be doing to our skin. And so, even if we, thought about, the soap and those types of things, we do have to think about the breakdown too. And so, while I believe in this and I really feel like it's so important, I want to say that now I'm a big advocate, and I do keep hand sanitizer in my car. I use it between every single patient, and just having an understanding now of what it can do for your skin, and not having that dryness, but most importantly, the breakdown, because we have to have moisture. We have to have protection, and for our skin. And when I say that protection, and when we're using soap and water, we're breaking down that layer of protection that is on our skin. And so this is where, I see a lot of assistants that will say, hey, Shane, you know what, look at my hands. And they'll say, well, is it the gloves? And I'm like, well, are you washing your hands in between every single patient, or are you using a hand sanitizer? And I will tell you that about 80% of the younger team members are washing their hands. And so this is where we really and truly have to think about, the common sense. And when I say common sense, I have to understand that myself, because this is where I made a mistake. So we want to make sure that we understand that, but there's nothing more important than protecting our hands. And when I say that, just thinking about, every single time in between patients, utilizing a product like Purell, which is the number one. I can tell you that I'm all about number ones, because I will say that there's something to be said for the brand and for the name. Patients recognize it. And so this to me is another important factor. But feeling good at the end of the day that the chemicals and the materials that are inside of Purell are there to help protect us and to make sure that our skin looks good and healthy and lasts as long as we can, because none of us are getting any younger. Now, I want to show you just a quick video. And this is something that, again, I think is so important. We actually took this video and we shared it with, because, a lot of times when we think about patient engagement, we have it in the waiting room and we have a TV. A lot of times our team is wanting to watch, all the shows that are on TV throughout the day. And we're like, no, guys, this is an education monitor, and we want education up there. But we loved this video so much that we actually email blasted our patients with our solution reach. We were able to take this video and drop it in for patients because we felt like, if we could get their buy-in, for those that are already doing it, great. But there's a lot of patients that still don't utilize a lot of hand sanitizer. And so we wanted them to really understand, why are we doing what we're doing? And I want to play that for you if I can. And let's see, hopefully it will play here. Let's go back. And if it won't, that's the story of my life today. If it won't, I'll make sure you get it. But it's a great video, and it really goes through, the difference between utilizing soap and water versus utilizing a hand sanitizer. And I will say that, these are the things that we really want to look at. And again, can't say enough about how much our patients and the feedback, they were like, thank you so much. We get so many videos from you guys about dentistry. This was something really nice to have, and to have an understanding of how to take care of ourselves and, again, our family. So I just want to make sure that you have that. Now, let's move on to this. Now, when we think about when do we use soap and water, and I will tell you that I love there's a lot of forms that we've been putting together for our team, and most importantly, giving this basics, back to basics. I think this is the problem in dentistry, is that we make things so overcomplicated and so hard to understand that we need to have a list. And when I say that, yes, we need to have a checklist. And so one of the things that I'm going to make sure that you get, that was a part of our podcast, was a download of when do we use hand sanitizer and when do we use soap and water. And I will say that this is where, again, the rubber meets the road. You would say, Shannon, that's so elementary. But again, I was beating my husband up, right? So anytime we're going to prepare food, before we prepare food and after, we always want to use soap and water. Before we eat, it's kind of like the old school, mom would say, go wash your hands, go wash your hands. Of course, we want to do that. Before and after we're caring for someone that may be sick, or someone that maybe you're going to a nursing home, and maybe you're a caregiver, or anyone in your house that may have a cold, not feeling well, maybe has a temperature, you want to wash your hands. After using the bathroom, you want to make sure that you're doing that. Now, I will tell you that one of the things that I do is when I go into a restroom, I'm using hand sanitizer. A lot of people will wait until they come out. I actually do both. And I will say that I think that that's something that we don't really talk about, is entering the restroom and doing it, before we go in and sit. And so that's something, again, your preference, but it's something that I do have on the checklist. Anytime after sneezing or coughing, we want to, wash our hands with soap and water. Also, after touching anything in a high traffic area. Today, I've been on a plane, 2 planes, both planes had issues. So it was just one of those days. So thank goodness I made it right at the final minute. But I will tell you that when throughout, those trips and plane rides, and as much as I can possibly wash my hands with soap and water, I will. But we don't have that privy sometimes. So I'm getting on a plane, I'm wiping my hands down with my Purell. And so it's something, again, I want to make sure of. Also, thinking about grocery carts, countertops, handles, phones. We're going to talk a little bit about this as we go on into the presentation of some of the things in our practice that sometimes we may not think about. And most importantly, what is the difference for that? So I just want to kind of throw that in and make sure you understand. This was something that we implemented several months ago. And I will say that it has been a very big deal in our practice. But one of the things that my team was scared about was what would be the impact from patients, because we have a very big office. We have, and I work in 2 different practices. I have one that's a little boutique practice and one that's a very large practice. We got 69 team members. We're like a mini village. And one of the things that we have is we have these beautiful Purell stations. Now, they're hard to find in some places. So if you need help finding those, you email me, I'll tell you where to get them. But I will say that this has been such an amazing game changer for us. And we have them all throughout our office because we have a very big practice. We have 25 ops. And so we don't want just one area where everyone can utilize the hand sanitizing stations. We have several. But I will say that we can't watch everyone. And I hate to say that, but, we still look at things and what, we're taking care of patients. And one of the things that I told my team is, if we really want to take that extra step, we're using our Purell in our in our stations, but why not have the packets or even utilize it when we're placing it on our hands? We should be asking patients. And one of the hygienists in my practice said, well, Shannon, that kind of might come across appalling to a patient, or maybe they might turn you down and may say no. And I said, it's all in how you say it. And so how do we do that? And I will say that it has actually been a great thing. Patients actually appreciate it. So when the patient is in my chair, one of the things that we will do is I will, of course, I'm going to place my hand sanitizer after I seat them. I'll put their bib on. I'll place my hand sanitizer on my hands, and I'll say, let me just give you some of this as well, just to protect you. And I'll go through, and I'm actually doing it as we're talking. So how are things going today? Do you know that I have not yet had one single patient tell me no, not a single one. And so I started out actually using the pump, but then I thought the little packets were better for me because, I would use the pump for our practice and for us, and then I would actually hand the patient a wipe. But I will tell you now, that was what I said in the podcast. Now I'm kind of eating my words. I actually found it was a little bit easier to just grab my little pump and hand it to them. And almost like, it's like as soon as they see it in my hand, they're like, put their hand out, And so I'm doing that. And my team said, well, how are you getting them to do that? And I said, I just start sort of my hand. I put it in my hand so they can see it. And then I almost like hold it up and they do it too. But let me tell you, I've had so many patients, especially one, and I can't, I'm going to try to get her maybe a testimony, but she goes, Shannon, thank you so much for thinking about me, and I said, listen, you're in the chair and we're cleaning these rooms and we are doing an amazing job. But the one thing that I know is when you walk in, you could be touching a door, you might be touching, a handle somewhere, you could be touching the chair underneath, and maybe we didn't. There's always reasons to make sure that you're protected. And that's really important to us in our practice. And I think sometimes just saying that, again, builds that family of relationships. And in dentistry, that's what we do. We build relationships. And so by having this, but one of the things that I also want to bring up is having that name. And I will say that, it speaks words. For me, I want a brand that I know speaks to our patients, but most importantly, makes me feel safe. And so this is something that, again, we've been doing, and every single team member is doing this now. And I think that it's just getting into that creature of habit. It's something that I've been doing now for weeks and weeks, and it just comes automatically. And again, not having a single patient say no. And I think that's huge. So again, we're here for them, right? Here for us first. Want to take care of our team, but the patient. And so that's something that I just wanted to throw out there. The other thing is that there's so many people that will send us text messages or message us. We have a chat room that basically is called Infection Control for the Dental Team. And I love this chat room because this is a place where team members feel safe and they feel like they can ask questions. And I will say, if you're not a part of it, please become a part of it, because it's very important to me to answer those questions that you might have that sometimes we feel like we can't ask, or we don't want to ask somebody and feel like maybe we don't know what we're doing, or that we feel stupid. And that's sometimes what people will say. And that is not the case. We want to make sure that you understand that there's no questions that are dumb. And again, if I don't know the answer, I know a lot of smart people. I know dummy. I surround myself by those people that are smart, and I'll get the answers for you. But I want you to understand that, the difference between sterilization, and when we get into now talking about instruments and talking about protecting our equipment, this is where we're going to lead down the road of some of those questions and some of those areas maybe that, again, we might not know, and we would think they would be common sense, but it still are questions that team members ask. So when we talk about sterilization here, it's a process that is intended to kill all microorganisms, and it really kill them on the highest level. We want to make sure that we are processing instruments correctly, which to this day, there are still so many questions. Not just sterilize them, we want to process them. We also want to make sure that, anything that we're seeing, we're taking care of. And that starts from not just instruments, the room, the equipment. And so this is something today that I just wanted to mention. When we think about what we call arbitrary asepsis, this is where we really want to make sure that, again, our team understands how do we set up a room and how do we break down a room. This is something that is so critical when we talk about new team members, because we don't really sometimes have the time to take them through every little area And so this is where I think these, step one, you do this, step two, step three, step four, and we have those checklists that we can provide to you to make sure that you're doing those correctly, but giving them an understanding that everything in the dental op has to be clean. We have environmental surfaces that are always going to be contaminated. I'm sorry, but let's just be honest, right? During patient care, we also have other surfaces where, again, we talked about touching. In our practice, we have curtains, but some offices and some of the rooms that we have, including my own personal office, has a door handle, and we're touching that, and so these are the things that, again, we got to look at, handles, knobs. Are you wiping down every single knob on your drawer? And those types of things are, something that, again, we're doing our very best, but we could sometimes, we know we're not perfect. Any of the areas where we're talking about, again, handles, tray covers, tops, mirror handles, anything that we possibly can look at, we have to think about what are we contaminating. And so as we get into talking about the number one area that I am asked about is cleaning rooms. And this is where I feel like, there's so many different products out there that it is confusing. There's a lot of products out there that, that ask you they have to mix chemicals, which we never want to do in dentistry, because I can tell you that when you talk about mixing chemicals, that, team members really and truly don't measure. We don't. I'm going to be honest, we don't. It has to be something that's already pre-mixed for us. And so that's where I start getting scared. I see a lot of larger organizations utilizing different materials out there where they're mixing with water or they're mixing with other chemicals. And I can tell you that to me scares me. And so in my practice, being the person that places the orders and the one that is the infection control officer, I really don't want to do that. But I cannot tell you how many offices are still doing this. And this is where, we really have to pay attention. The chemicals that we're utilizing, we're cleaning, any visible dirt, soil. We want to make sure that any debris, and this is something that when we think about cleaning, this is not disinfecting, cleaning. Okay, we see this a lot where they're talking about using soap and water on certain pieces of equipment. Again, any visible dirt. Disinfecting, what we need to understand is that it eliminates bacteria, fungus, any viruses. It does not remove the dirt. So we have to clean still, and we have to disinfect, and now we're going to sanitize. And so these are the three things that I think sometimes we just don't really focus on or really know the difference. And so if there's anything this week, if you take something to your morning huddle, this is something every week in the huddle, we always take about 5 minutes in the huddle to talk about something, just one tip, one thing. And if you do that, you'll have so many people have so many different interesting things that they will bring up. And we actually assign different team members to do that. And so everybody has their own week where they have to come up with 4 different things. And so this was one of my things. I said, one of the things I want to make sure of is that everybody understands the difference between cleaning, disinfecting, and sanitizing. And so here, when we think about sanitizing, this is where we're going to reduce the number of germs on any surfaces. We want to make sure that all the objects, are really, disinfected, sanitized to or sanitized to a clean level, the level that we need to, and then also judged by public health standards. And so cleaning, disinfecting, and sanitizing, there's 3 different things here. And so we want to make sure that everybody on the team understands that. We also know that when we get into these contact areas, there's a lot of people that utilize a lot of barriers, and I do use barriers, but I will tell you that I know, just like everyone else, when we think about, putting a chair bag on the chair, are there, handle covers, are there covers that are on your keyboard, a lot of different things, things that we're thinking about our cameras, and utilizing our Canons, our Nikons, our Shofu cameras. There's so many areas that we have to really look at, from light handles. And this is something that, again, you have to lay out for your team. These are the areas and contact surfaces. And a lot of times team members don't really know or really think about that. The light handles, the switches, anytime we're turning something off and on, including lights, the radiograph equipment, any chairside computers. This is where sometimes we're not even looking at the computers or the mouse. Utilizing in my room, I have a huge TV and I have a remote that I use. And I was like, oh my gosh, you know what? I didn't really think about the remotes. So this is something, again, making sure that you understand what are those contaminated surfaces. Faucet handles, countertops, pins, tablets. computers, monitors, phones, doorknobs, drawer handles, cameras. Again, we talked about it in X-ray equipment. These are the areas that, you have to ask yourself, is it something that can be wiped down with the chemical that you're utilizing, or is it something that has to be, bagged and covered? And so that again goes back to, are you really sitting down with your team and going over these things? What chemicals are you looking at? And this is something that, again, another gray area for us was, we always were told, hey, use soap and water when it came to a lot of the equipment, including the chairs. And to me, that just did not make sense. It was like, okay, well, why am I going to, utilize, my wipes and my spray to, disinfect and clean everything in my room, and then go get soap and water to wipe down my chairs? And so when I was talking to one of my team members, this was several months ago, I said, tell me what you do. And so we even asked some of the team members in our chat room, and they were like, well, we just use soap and water, and then we just try to, wipe it down that way. And I said, oh my gosh. I said, well, why are you not utilizing, your disinfectant spray or your wipes? And they said, oh no way, because if we do that, it's going to change the color of the leather, and my doctor will make us pay for that. It's a payroll deduction is what we call it, our PD. And I said, well, then you may need to be thinking about possibly changing your disinfectant wipes, because I can tell you that for someone who has beautiful brand new upholstery, this was something that I was even scared of and would never utilize, because I can remember using a different brand of wipe, and I'm not going to mention it, but I had a brand new Cure and Light from a very famous dentist named Dr. Dan Fisher. And I love Dan Fisher, and he's the owner of Ultradent. If any of you have heard of Ultradent or Opalescence, he's the founder and the owner. And he had only made these Cure and Lights, these Velos. They were pink. And I should take a photo of it and put it in the presentation. And I will tell you that I used a different brand of wipe, and this brand turned my beautiful pink Cure and Light white in certain areas. And I can almost cry. I mean, you can tell I'm very upset about it, and can't get it back, and there's only one Dan Fisher, and he only made so many of these. And so I can tell you that this was something that really was disappointing. So if we look at, exactly, why do we need to understand what are we using and what are the chemicals? This is something that I want to just make you aware of and paying very, very much attention to. So when Purell came out, of course, we were using their hand sanitizers, and I will tell you that name was so important to me. But the main reason why I switched from one other brand to Purell was honestly the fact that not only did it kill all of the viruses that we were hoping that it would do, right, everything that we should be utilizing, and looking at the back of the canister. I will say that the most important thing for me was that you could utilize it on wood. We could use it on leather. We could use it on every surface available in the dental op. And that was a big deal to me, because I had already just shared with you that I was very upset. And then I started thinking about my Canon and my Nikon and my Shofu camera, and what other pieces of equipment in my office was I placing these harsh chemicals on that was going to change the color. If it was black, it was going to turn it gray, or maybe even turn it white. If it did that to my pink Velo, it's probably going to do it to that. And so I was kind of scared. But then when I started looking at, got the canister, I turned it over, and of course I'm going to read what's in it. And I'm so grateful, because I would tell you, it's finally we got a label that we can read that makes sense. And then the other thing is the fact that it kills, and I'm going to read a little bit about what it does. So it's going to kill the human coronavirus in 30 seconds. 30 seconds. So then I started taking these wipes, and I was wiping off the phones. I'm wiping off the countertops. I'm wiping off the door handles, and I'm just thinking, okay, where else? Because we know that, there's a lot of places that everyone is going to touch, but most importantly, we're exhaling, and we think about all of the, all the other areas that we don't really talk about as far as the aerosols. So this was something that, again, was really important. The other piece of this is the smell. And there's a lot of different wipes out there that have this smell that smells like funk. You know what I'm talking about? Funkadelics is what one of my other team members says. And it's horrible smell, so not only does it smell bad, when you've got something that actually is corroding your instruments, corroding your equipment, now you've got something that smells really, really bad. This is where, again, the rubber meets the road for me. The other thing is I didn't have to add chemicals to it. It already came It's available, and this is the surface disinfectant wipes. It has a spray, and it also has the wipes, and I love that. I am a really, really big fan of the fact of having a wipe that has enough of the solution on it to where I just, because some people have to be very conservative. There's some doctors out there that don't want us to use more than one wipe. We know that, right? And I would tell you that I don't like wimpy wipes. And so I'm kind of I guess a snob, with that. And so I like the fact that it's very, very much desiccated so I can really clean everything. But here is the ticker. This is my own personal equipment. Now, I'm going to be honest, and no offense, dentists out there, but I'm going to tell you right now that when I am thinking about my own equipment, my own Velo, my own chair, my own dental op, and yes, it is mine. It's my purchase. I will tell you that I have a brand new chair, and I was really scared. The first thing I thought about was, oh my gosh, if I go to put this wipe on my chair and wipe it down, what if it turns color? But it says here on the label that it will not. And I will tell you that this was the number one reason that I switched, because I said, I'm not going to go get soap and water. I'm just going to be honest with you. I'm not going to do that to wipe down my chair. I really want to make it simple, and I want to lead by an example. And I told my team, we've got to make this simple. If this type of name is great for hand sanitizer, and now they've placed it into a wipe or a spray, we're using it. And again, thinking about all my younger assistants that are in my practice, I just said, guys, we don't have to do this anymore. We're able to really and truly have something like this that really is going to work, and most importantly, save us on the fact of not having to change the color of the chairs. And that's a big, big deal with my doctor and with our practice. Now, I want to just mention one little thing really quickly, because there's a couple of people that are asking some questions, and I think that this is something that I want to just kind of answer for you. And one of the things, the first question was, is it necessary to use a barrier on the air water syringes, even though it's been wiped before and after? That is total preference. That is something that if you want to use, barriers, you can. I will tell you that I'd be lying to you if I told you that I do. I don't, because, utilizing a chemical like this that I know is going to kill everything, I feel very safe. And so I don't. And so this is something where I want you to feel comfortable about whatever choice you want. For me, sometimes I do worry about having plastic. And when I take the plastic off, did it really keep everything from getting saturated? So I just got to be honest with you. I just feel like this is something that I really want to, have you, think about. But I will tell you that I really like the fact that I'm going to wipe it down anyway. So why not just wipe it down? So I would say it'd be your choice. The other thing is that I want to answer Tiffany's. And Tiffany's question was, so we have to disinfect and leave it till it dries and wipe all of this extra stuff, but we get no extra time. Tiffany, I am with you, girl. Let me tell you, I totally understand. I will tell you that I think this is the hardest thing, but I would say go and look at whatever chemical you're utilizing, because sometimes it starts with the chemical. And I can tell you that even in our chat room, there was a lot of people that were talking about other products. And I don't want to say that because this is not about bashing anybody's products or anything like that. I'm talking to you about one that I love because I finally found one that cleans and does the disinfecting and kills everything that I want it to kill. But most importantly, now I can use it on my equipment, was the number one reason why I switched. But I will say that a lot of the chemicals that are out there right now, you've got to mix them, or you're really, you have to think about how long it takes to kill the viruses that we need it to. And so this is where I think having the switch and just trying it, because here, when you think about it, 30 seconds, right? 30 seconds disinfection for MRSA, all the things that we really need. MRSA, I'm scared of MRSA more than anyone because my stepfather actually had MRSA. So that to me is very, very scary. And thinking about all the other viruses that are out there, I would say that that's what I would go back and look, and again, having that time, because for 30 seconds, oh my gosh, 30 seconds to us, that is no time at all. We definitely can make do with that. And so that's where I would tell you to go back. And so again, having the extra time, I totally agree with you, but really investing maybe in a different disinfectant is what I would say might be the answer for you. A lot of people too also, and this was something that I wanted to just mention, is there are a lot of hygienists out there that still utilize 4x4s. And when I say that, the gauze, they'll just take the the disinfectant and pour it into the 4x4s. And there's something that I want to make sure that you understand is, as long as you're utilizing those 4x4s that day, you're fine. this is something that, again, I think that we kind of, a lot of people went away from the 4x4s, but the problem is that, it evaporates and it breaks down the galls. And so if you want, and you're maybe one of those 4x4 kind of team members and you want to use those again, you can, but just tell yourself you're only going to put out enough that you're going to, the 4x4s that you're going to use during that day. And then you're golden, you're safe. But I will say that the reason I think we use 4x4s is because we want more of the chemical absorbed into whatever wipe or towel or gauze that we're using. And this is a big difference. I really challenge you to try this product because of that. And I think that's one of the number one reasons. It's very hard to open a 4x4 and try to wipe everything down. And so to me, it's just a no-brainer. Now, so let's talk a little bit about, what are some of these critical areas? Because when we think about, again, going back to the common sense critical areas, I think that, we really want to understand that critical is something that is going to penetrate soft tissue, whether it be, a forceps or some type of instrument that's going to go into the body. We think about a lot of surgical instruments. And then the semi-critical is where we're going to, have something that may not, penetrate or contact with bone, but we still know it's going to penetrate the bloodstream. And so this is something that, again, your team may not know these things. What is critical, what's semi-critical, and what is non-critical. And this is where, again, we would base the chemicals and the materials that we're utilizing in our practice on those three areas. And so the non-critical is where it just has contact with skin. We're just thinking about, the disinfection and utilizing, again, some of the disposable barriers if possible. And so I just want to make sure that we do understand that. When we think about, is Purell, and this was a question that Kimberly just had, and Kimberly, you're going to love this. Absolutely. It says, is Purell safe to wipe face shields? Yes, it is. I will tell you, personally, because I was like, man, if I'm going to talk about Purell, I got to make sure that I know that if it tears up my oroscopic loops, I'm going to be really upset. So I can tell you that one of the things that it did not, I was able to use it. And so I would love to show you. I even took some videos. And so I'm able to use it on my shields. I'm able to use it on my loops, which is something we never were able to do before. Now, granted, it's going to be streaky, through the glass. So you do want to wipe that off. But I will tell you that I worry about that, and so again, just taking my loops off and sitting them somewhere, making sure that they're clean. My Canon, again, we don't have barriers for a Canon and a Nikon. We're using those every day. This is something that, again, you can feel good about utilizing and again, having that. And what a great question, because I can tell you that there's a lot of people out there that are worried about their face shields and then messing up and having it even eat through. And that has happened. And so when we were putting this course together, I was asking one of my really good friends, her name is Lynn Atkinson. She's a very famous laser hygienist. And I said, Lynn, tell me what you do. And this was before I was going to be doing this webinar. And I said, hey, Lynn, tell me what you do whenever you're cleaning your shield. What are you utilizing? And she said, soap and water. And I said, soap and water. And she said, yeah. And I said, wouldn't it be nice if you ever had something you could utilize or a product you could utilize that would not only, eat through the plastic, but most importantly, give you that film. And she said, yeah, it would be. And so I told her, I said, I think I've got something right now that you can utilize. And so she was like, oh my gosh, you got to tell me and you got to send it to me. So I will say that I think this has made a big difference. What if the doctor doesn't want you to use the Cavi wipes and only has hand sanitizing wipes in each op to clean the rooms? So let me just tell you that this is, I don't use Cavi wipes. This is the Purell wipes. But if it says, if I'm just going to make sure that, Camille, I do understand you correctly. What if a doctor doesn't want you to use Cavi wipes and only has hand sanitizing wipes in each op to clean the rooms? The hand sanitizing wipes, I will tell you, is something that you really, it's for your hands, it's for your skin. You really have to have, and if you need me to give you the information to share, now again, it's something that you have to protect yourself, and this is something that I want you to really consider if I need to give you the information on that. But hand sanitizing wipes is something that we really should not be using. You need a disinfectant wipe. And so again, don't want to make you feel bad for asking the question. I'm glad you asked the question. And sometimes if we see things that are wrong, it's hard to bring it up and you need the information. And I will tell you that there was a practice that I was working in during COVID that had burrs on the countertops. And I said, hey, listen, you guys, we can't leave these burrs on the countertops like this. We've got the aerosol And they would look at me and like roll their eyes. And I said, guys, you're not doing this. We need burr blocks that are covered. I'm sorry, but it is like the law. This is something you cannot do. We cannot do this. And it finally got to the point where I just couldn't work there anymore because they were not going to change. They had it this way the whole time, and all these burrs were out in the open. And I just couldn't sleep at night, and sometimes those are the things that you have to. But I brought in, I'm a member of OSAP, and I brought in a lot of the information. And so for any of you on here tonight and you're not a member of OSAP, you should, because they give you so many guides and so much information for you to be able to take back to your office to be able to, I say, plead your case. Because, sometimes when we're trying to convince someone or we want them to see and understand that we're not doing things correctly and those protocols that are set in place, they can look at you and say no, but I feel like, you have such a better way to present it by having, the ammunition that you need. And Camille, I would love to give that to you. So you get my email at the end and I'll make sure that you have all of that. But having an understanding of these things, is something that, again, going through and just making sure your team knows what's the difference, having these, again, this was another piece of this in the morning in the huddle. I just said, hey guys, let's just go over quickly what is the critical areas and what are the semi-critical areas and what are the things that we need to make sure that you should be, wiping down. And another area of this that I didn't mention was thinking about the lead aprons, and also the x-ray heads, that's something that, again, a lot of times people will bag, but I will tell you that I have gone into offices where the bag has never been changed. It's been sitting there and it's in the same bag for months and months and months. And I would tell you that I would much rather you not use the bag or the barrier and use, a wipe. But let's talk about now the things that we're doing with our taking blood pressure. And this is something now that I'm even doing in my little boutique shop, is I am taking blood pressure, and it's like, okay, well, how am I going to wipe this down and make sure that this is clean every single time? Because patients look at us, they're always sizing us up. And this is something that, again, I didn't want something to eat through my plastic or turn my white blood pressure cup brown, and so I had never used a disinfectant wipe on it. And now, again, I can feel really good about that, because if I can use it on my orthoscopic loops and I can use it on my chair, I can use it on my blood pressure cup. So again, just kind of thinking about that. The other piece of this is that I want to mention another area that sometimes nobody really talks about is utilizing, we know that we have to have legally, a way for us to transport the instruments from the op. We're going to go from the room to our sterilization area, and we have to have these instruments covered. Now, believe it or not, there's still a lot of people that don't know that, and this is something you need to know. It is set in stone that this is what we have to do. We have to, cover our instruments. And this is, again, where we think about the instruments that we're utilizing, we're placing them. So we're going to bring them to the room, in our sterile, environment, and then we're going to utilize those instruments. And now we need to cover them and transport them back into the sterilization area. And I know the reason why they passed this where we have to have covers is because I'm sure someone probably tripped and fell on an instrument and got hurt, or something happened. And I'm so glad that they did change that, but it needs to be a Rubbermaid tub. Something has to have, whatever you're going to use, it has to have a cover. In our practice, we use Zerk. I love Zerk trays and tubs. I use their instruments. And I love Hu-Friedy too. Don't get me wrong. I'm a Hu-Friedy girl as well. But I will say I love tubs from Zerk and their tray system. It's amazing. And I love the color coordinating of this. But this is a question that I get, because one of the things, again, going back to the disinfectant wipes, was what are we using to spray down the rooms and spray down the trays? Because we can't put them into the autoclave. We've got to be able to wipe them down. And so many people don't want to have to use plastic barriers for the trays. But let's say you do, you still have this cover. And so when we were utilizing, other products out there, the cover would turn almost like a frosty appearance. And so we were like, not being dumb here, but this is, even for me, my team was like, well, what are we going to utilize to wipe down these trays and covers? And I said, well, this is where, again, we got to think about that, because the last thing we want is for something, that we know is clean to look dirty to a patient. And again, going back to, having something that I know is not going to turn my trays a different color. And most importantly, the covers, because again, I want to be able to see through those, but it's always about patient's perception. And so, when we go back and we look at so many areas that we feel should have the answers to, and it should be something that's automatically understood, it's not. And so I feel like, in dentistry, we have all these courses, we have all these webinars, we have all this training, and sometimes it's so far over our heads that it doesn't make sense to us. And I think we just think that everybody on our team got it. And we don't. I think we've got to get back to the layman terms of just saying, hey, you do understand what we do with this, right? And we do understand why we're doing things this way, and helping them to understand that. But most importantly, for someone who just opened my own dental suite, I can tell you that I never knew what things cost because my name was not on the door. I really took for granted of that. When you think about having to buy cabinets, I had to buy 2 dental cabinets. I had to buy the back cabinet. I had to have suction and air water, and and then having a really nice chair that when the patient sat in it, they didn't feel like they were sitting on a papoose board. Now I've got to think about all the equipment that I paid for. And I can tell you that I have an overall appreciation now, even a more appreciation. I already knew about equipment, materials, and taking care of these things, but now it's even more important. And so I think about, so many people will talk to you about infection control. To me, that wasn't the main stage for me tonight. It was to give you just a few areas of hand sanitizing and really understanding the difference and what we got to do to protect our skin, because you only got one skin, you only got one body, right? So thinking about the hand sanitizer, utilizing the packets for those patients. I mean, I just bought the little tiny ones to give away. We're always looking at what can we give away to patients. And it's funny, we can give them a free crown, but if we give them a little bottle of hand sanitizer or some lip balm, you'd have thought we'd given them $1 million. And so this is what I told my doctor: don't give away the crown, don't give away the night guard. Let's give away some Purell. And then thinking about your own safety and your kids, right? Thinking about your steering wheel. Think about, the light switch, the doors. One of the things that my team has set aside now is 4 times a day, we have a time that we have to stop our team up front and clean, the door handles and the windows, and making sure that everything is nice and clean and everybody has their own zones. And we switch those zones every week. And I go out that front door, in and out. If I'm going to walk my patient out, I'm touching that door and I don't have gloves on. And so again, I want to make sure that everybody is aware of those things. But when I get in my car and I'm touching my cell phone and I'm touching my steering wheel, this is the steering wheel we never think about, right? And touching all the things that, again, we really need to be aware of. Getting down to cleaning your chairs and cleaning your equipment. And if you don't want to use barriers, what's the right thing? Having one brand, I think, is so, so important. And then understanding, again, having something that you can wipe down that's clear, your loops, your camera, having the covers and not feel like, oh my gosh, this is going to change. And then most importantly, these very expensive chairs and stools, again, we can feel good about that. And that to me is such a big, big component. Let's ask just a few more questions here. What about your thoughts on using UV light wands over and on non-critical surfaces? Jennifer, I love you right now. I'm so glad that you asked that. I will tell you that I'm a big subscription person. I have my own subscription box, and I also subscribe to a lot of subscription boxes. And there was a box that it's called the Brio box. I don't know if you guys have heard of that. And I got a wand, and it was a disinfectant wand. It was UV light. I will tell you that I'm still a little skeptical over that. And so I feel like, there's some data there, but do I know that it also is killing viruses? And I think that this is where we really and truly have to think about the UV wand, and something that I know is going to kill in 30 seconds. So I love your thought process. I love what you're thinking. I use it on my bed sheets and on my bed and around my bed. But I will say that I also use my Purell for those other things. So something to, again, really think about. So one of the things that, again, I want to just make sure that we're answering tonight, just getting back to these questions really quickly before we close. Do we feel that we need to use paper tray covers if we're changing out the trays in each patient? No, I don't think you need tray covers at all. I don't use tray covers. Again, totally up to you, but I'm all about saving paper. And then the last one, how does the price of the Purell wipes compare to the Cavi wipes? I will say that the Cavi wipes are a little bit cheaper, but I will tell you that it's worth every penny. It's only maybe $1.10 more. but you're getting something that's a lot more saturated and you're getting more wipes. And so I really would encourage you to look at it, and again, take a look, and always buying things in bulk. I'm all about buying things in bulk. I feel like makes the biggest difference, because if you can buy things in bulk, of course, the fee is going to go down. And so again, look at that. And there's always great deals out there, especially with a lot of the courses coming up. So check out those deals. And again, thank you so much for your time tonight. I appreciate all of you. I could go on forever. You know that. Thank you so much. And I look forward to hopefully hearing from you, seeing you again. You can email me at any given point, Shannon@chairsideassisting.com. And I appreciate you attending tonight. And I hope everyone has a wonderful, wonderful weekend. Take care.